Hi, good morning guys. It's Dr. Denney over at Four Paws at Fulshear Veterinary Clinic. And we're going to be going over some frequently asked questions that clients might have regarding anesthesia and their pet. Maddie's going to kind of kick us off and start asking you some of those questions to get you some answers.
Dr. Denney, what are some of the risks and side effects of anesthesia?
So we kind of touched on this on the other video, okay? But risks with anesthesia are very low, okay? The incidence is super low. I think in this practice we've only had maybe 2 incidences in almost 4 years, so it's an extremely low risk. But there is always risk. The biggest one I would say, and the one that scares most owners, including myself, is that, we can lose them under anesthesia. They can go into cardiac arrest. It can be a drug reaction, an underlying heart condition that was silent and we weren't able to pick up on. Unfortunately, there are certain breeds of cats that can have silent heart disease, like our Sphinxes or Maine Coons, which is why we do a lot of preoperative monitoring and or testing to make sure they can safely undergo anesthesia. And the same with our canine patients. That's why every patient gets a preoperative exam. Every patient over the age of 4, our blood work, preoperative lab work is not optional. We do strongly recommend it for pets that are under 4, but it is optional. But part of what we're looking for is infection, red blood cells, white blood cell, platelets. What are our organ functions with our liver and kidney? What are our electrolytes doing? Do we have normal clotting times? Because if we're having surgery, we need to make sure we can clot. So these are, possible risks, possible complications from anesthesia. Even though we do place a breathing tube down to protect their airway when they're asleep, aspiration pneumonia, or when we get contents into the lungs from the esophagus, like if they regurgitate or vomit while they're under anesthesia, is a risk. But that's why we have a trach tube down, or a breathing tube. It's not 100%, but it is damn near close. Those are going to be kind of our biggest risks with anesthesia and biggest possible complications. There's, if we get into different surgeries, there are different complications with each surgery. And if your pet is having one of those surgeries, we do go over those risks with you before the procedure.
How will I know my dog will be safe under anesthesia?
So we do our very best with our monitoring and keeping owners updated, because anesthesia is scary. It's the unknown. I want to say that as a pet owner and as a veterinarian myself, we like to have control of the situation. And when you have a pet under anesthesia, like when my dog's gone and had anesthesia at the specialty hospital, I'm not in control of that. And that's scary. So things that we do to mitigate that and to make sure that every anesthesia procedure is safe is monitoring. So every pet has a dedicated veterinary technician that their sole purpose and all that they're doing is paying attention to monitoring and monitoring your pet. We watch vitals, heart rate, respiratory rate, temperature, blood pressure, CO2 levels, EKG readings, oxygen levels in the blood, body temperature, you name it, and we're tracking it. We like to watch trends. So if something is trending down, we adjust to fix it. So we don't wait till there's a problem. We're very quick to recognize a problem and fix it. So we have very, very few anesthetic complications here at Four Paws at Fulshear. I would say if you are looking at other practices, those are questions to ask. What kind of monitoring do you do? There are some practices that may just use an EKG lead, which is just the electrical conductivity of the heart. For me, that's not quite enough. I want the same monitoring that I get when I go under anesthesia on every patient that I see. So we are very stringent in our anesthetic processes here at Four Paws at Fulshear, and your pet will get the best care and will be completely monitored the whole time. Because we are a small practice, our patients, we one at a time. Okay, we always have one nurse with a patient. Your pet has a nurse with them until they're fully recovered. They're never alone during that period. So these are things that we do to make sure that our patients have a healthy and happy recovery.
When is anesthesia not necessary?
So I would say, these are going to be the instances, and this is a good question because so many people, if there's like a little skin tag or something, they're going to not want to put their pet under anesthesia. Or if we have like a 16-year-old dog with a heart condition, I'm not going to want to put them under anesthesia. But we do have some options, okay? If there are small skin tags that are irritating, either to the pet or to the owner, we do have cryotherapy here, which is where, and it's painless. It is cold, but it involves freezing these growths off. And generally we can avoid anesthesia with that. In some cases, we can try to do local anesthesia. Because the lidocaine stings, some pets will not tolerate it, and any procedure that's going to be done on the face will require sedation and or anesthesia. That's just not something we're going to get away from because we only get 2 eyeballs. So those are really important, but those are going to be times that anesthesia is going to be very needed, versus if we have a skin tag on the top of the head that keeps scabbing and is gross and a little cauliflowery little benign growth, like that's something we're going to be able to use the cryotherapy and freeze that off without anesthesia. All right, guys, I hope this helped answer some of your questions. I know anesthesia can be scary. We are here to make sure that you are fully aware of what's going on with your patient. We give lots of updates, frequent text messages, pictures. I know that things are scary. I feel anxiety myself with my own pets. So if you do have any of these concerns, if you are feeling nervous about your pet that's about to go under anesthesia, please don't feel free to give the clinic a call, and one of either my staff or myself would be happy to talk to you a little bit more. Thanks, guys, and have a great day.